Wake up!
Get up
You get out of bed this instant.
and turn it on. Glenn, Angel, and the Flying Dutchman. The Big Show on Kiss 92.
Good morning and welcome to the biggest and best breakfast show here in Singapore. It is Good Morning Doctor Day, and so we welcome Dr. Joseph Toh, consultant dermatologist from Parkway MediCentre, the Dermatology Clinic. Good morning, Dr. Toh.
Good morning, everybody.
You know, when you meet Dr. Joseph Toh, you kind of don't really have to ask what he specializes in. Look at his skin.
Yes.
Look at your flawless skin, Dr. Toh.
I think I've watched some Korean drama before, and I can say that Dr. Toh looks like one of the
Like a
doctors in
K-pop
one of those.
star?
Yes, K-pop
okay.
star. Correct.
Not yet.
And he's come in his uniform as well, you know, it doesn't help. Okay, so Dr. Toh, you are a dermatologist, but today you're going to be speaking specifically about a skin condition that does plague some people. I'm not sure how common it is. Can you tell us a little bit more about psoriasis?
Psoriasis is actually quite prevalent. I mean, about the world population, we have around 1 to 2% having psoriasis in some form of psoriasis. So that's, if you can think about it, is 1 in 50 people having psoriasis. So actually, it's quite common.
Okay, so
Is one group of people more prone than another group?
Psoriasis tends to affect patients who do have certain risk factors, so such as mild obesity, patients who tend to smoke, patients who also has other metabolic syndromes also are more prone to having psoriasis. So very commonly in Singapore, we see patients with diabetes, hypertension, hyperlipidemia. So these are the patients who are at higher risk of getting psoriasis.
Oh, so psoriasis is not something you're just born with.
Well, psoriasis is somewhat of a hereditary disorder. So, I mean, you usually inherit the genes from your parents, but those genes doesn't usually switch on unless there's a
Trigger.
suitable or a particular environmental trigger. So, about 10% of patients have a family member with psoriasis as well, but it's not a 100% kind of thing. So, it is something that we can probably work to reduce environmental trigger to sort of like reduce the risk of manifesting psoriasis.
Okay, so doctor, what's the difference between psoriasis and eczema?
Yeah.
Psoriasis is really a skin thickening problem. I mean, the cells of the first layer of the skin proliferates very aggressively, and then that causes thick scaly patches on the patient's scalp, sometimes of the body and the limbs as well, and usually on the what we call the extensor surfaces, so this is what we call the elbows and in front of the knees. Sometimes it can also affect the hands and feet as well as the genitalia. It usually manifests in scaly plaques, and sometimes it's a little bit more aggressive than the usual dandruff. So patients might feel that they have like dandruff, but unless you get it properly examined, so sometimes they get misdiagnosed as well.
So you're saying the scalp is usually where it starts?
You can get scalp, but you can get it also on the body and the limbs.
Okay,
yeah.
all
So
right,
back,
okay.
buttocks,
Okay.
knees, elbows.
Wow.
Okay, let's continue to talk to Dr. Toh on the Big Show TV. Meantime, here's J-Hope with Neuron on Kiss 92. Wow, so if it's on the scalp, chances are there will be hair loss as well.
Not necessarily. You can have scaly rashes, you can have scalp itch, but you may not lose your hair with psoriasis.
I see. Okay.
Does psoriasis come in different degrees or different types?
Yeah, so there are many forms of psoriasis. So the most common form of psoriasis is what we call plaque psoriasis. So you get discrete patches of very unsightly red rashes, which is difficult to hide, and that causes, obviously emotional distress for patients. You can also have rarer forms of psoriasis, such as a guttate psoriasis, where it comes in a raindrop appearance on the entire back. You can have pustular psoriasis, where you get little pustules, pimple-like lesions on the hands and feet, as well as the body. You can also get what we call erythrodermic psoriasis, where your entire body has red rashes.
Oh my gosh, so many different things. So what does one look out for? Let's say they've never had psoriasis before in their life, and they've got some itching, whether it's in the scalp, the elbows, wherever you mentioned before. What do you look out for to think you do have it?
Psoriasis tends to flare with emotional and physical stress. So whenever you are stressed, sometimes psoriasis do get worse. They wax and wane. physical stress such as friction and injury to the skin, like sometimes a scratch can trigger your normal skin to develop psoriasis rashes there. So this is what we call cauterization. Patients tend to also can have nail changes. So as part of our skin, the nail can develop what we call nail psoriasis. So that comes in the form of what we call pitting. So you get little pit holes on the top of your nail plate, and that is seen around 50% of patients with psoriasis as well.
Wow.
Psoriasis can also affect your joints, so we call it psoriatic arthropathy. So the small joints of the hands and particularly the hands can get swelling, and in rare, very advanced cases, you can get deformities. So that can also affect the patient's ability to handle intricate things that they can do with their hands, such as picking out small objects and even wearing their clothes.
So it's not just something that's on the top layer of the skin. It can go inside with the joints and all that and affect your mobility.
In very severe cases of psoriatic arthropathy, yes, you can. Psoriasis is also linked to chronic inflammation, so chronic low-grade inflammation. So patients with psoriasis can also develop, as I mentioned, metabolic syndromes such as high blood sugar, high blood pressure. Can also be linked with heart disease, so cardiovascular events, and obviously having rashes that's so prominent, difficult to hide, can cause psychiatric issues like depression, anxiety as well. Yeah.
Wow, it's more than just an itch, huh?
Yeah,
Oh my
I thought it was
gosh.
just an itch and a thickening of your skin, and that's it, but it's not.
Is that skin conditions can cause psychiatric
Of
problems.
course, yeah.
Even like we were talking about this a few weeks ago, right? People with let's say really bad acne also affects their mental
Of
state.
course,
absolutely.
yeah.
We've talked about the environment that affects people with psoriasis. We've talked about stress and anxiety and things like that. Can food affect psoriasis? What you eat?
Not in particular.
Not in
so
particular.
I don't think any food is known to cause psoriasis to flare, but certain medications can. So certain types of anti-blood pressure medicines can trigger psoriasis. Certain types of psychiatric medicines can also trigger psoriasis, and oral steroids, when given in a wrong manner, can also trigger psoriasis as well.
What about the weather patterns? Like, when it gets super hot,
Yeah.
we get like prickly heat and stuff like that. Does it affect people with psoriasis?
Definitely, I think the rashes, the psoriasis rashes itself can be quite itchy in our very hot and humid environment. So when it gets more humid, sometimes you manifest more of this itch sensation. So definitely, yeah.
Wow. I mean, there are some people that you walk past and you know that they have a skin condition. When it comes to something like psoriasis in particular, is it contagious? Will you catch it if you rub against somebody with psoriasis?
It is a misconception, and a lot of people assume that psoriasis or other skin conditions are infectious, but psoriasis is really not an infectious problem. So if you're someone you're in close physical contact with may have psoriasis, you can't catch it from them. So it's from internal, where your immune system is a little bit more overactive. So rest assured, it's not infectious.
So it's not an autoimmune.
It is somewhat of an autoimmune,
okay.
whereby your immune system is overprotective of you and overreact in certain manners when it is triggered in some sort of environmental trigger.
Oh, right. Okay. Got it.
Wow. I always thought of it as just a rash and itch. You've got psoriasis. There's so much more to psoriasis than I ever
to
imagined.
me, whenever I hear the word psoriasis, right, as I mentioned this morning, it's like another level. Because everyone talks about eczema.
Yeah.
That's like very common among people, usual normal rashes. But psoriasis is something else. I think we may have had a friend years ago who had this condition. Of course, I'm not going to mention his name.
Yeah, of course, yeah.
But where he was just itchy all the time and red.
Yeah, and it shows on the skin.
How does one treat psoriasis then?
Psoriasis, many levels of treatment. Obviously, if it's a very localized mild psoriasis, we can treat with some topicals, which includes topical steroids. Currently in the trend nowadays, we try not to give steroidal topicals as much because due to the concerns of side effects from steroids. So we do have steroid replacements such as topical calcium inhibitors. Sometimes we do give topical vitamin D analogs to help with patients with psoriasis. In the cases whereby the rashes are more extensive, then we may want to consider something that is easier for patients. So ultraviolet light therapy can help in the form of narrowband UVB therapy. Sometimes we also use ultraviolet A therapy, but those are a little bit inconvenient because the treatment is usually quite frequent. We are talking about twice a week. So having the patient come over to a healthcare institute to administer that treatment might not be something that is doable for a lot of working adults. We do have oral medications, which is immunosuppressants that help with patients with psoriasis, and that has been popular in the last decade, but also has its own issues in the form of the need for blood test monitoring as well as other side effects. Currently, the trend of thinking would be to receive what we call targeted therapy or biologic therapy, which is the use of monoclonal antibodies to help go to the immune system that targets the part that gives rise to psoriasis to sort of make psoriasis go away. So these are more novel treatments and potentially can help patients who are suffering from psoriasis for such a long time. I think eczema is a lot more common than psoriasis, but as you guys correctly pointed out, I think psoriasis patients tend to not come forward and receive treatment. They assume that is something that is untreatable, which is actually really not. I think may have to see the right doctor as well as get the right diagnosis to get the right treatment.
Okay.
Stand by. We're going to go for a traffic update and then back on air.
Kiss 92 traffic.
A couple of situations to look out for on the KPE towards the ECP. A vehicle's broken down before the airport road entrance. Also on Upper Bukatima Road heading towards the city right after Hillview Road. Another vehicle is having a little bit of trouble there in the right lane. If you spot anything else, it's 8855
Good morning and welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Joseph Toh, consultant dermatologist from Parkway MediCentre. Once again, good morning, doctor.
Good morning.
So we're getting a lot of comments on our Facebook page. Alice's daughter has psoriasis, and she's on injections to control it. That's one. Dan has come in, and Dan says, I've had psoriasis for 20 years, and I'm currently using Tal's injections every month to control it.
Why does he have to get an injection every month, doctor?
To suppress it? Is that what it is? Control it?
So this patient may probably have failed the first or second line treatment whereby the patient is usually on topicals, or as I mentioned, if the psoriasis is really very extensive, it's really not possible to put creams and ointments on the entire body on the twice a day basis. So targeted treatments like the Tal's injection might be helpful.
Okay. So with Dan or with anybody else, Allison's daughter or whatever it is this a lifelong thing they have to live with? Does it ever go away?
Psoriasis is usually a lifelong condition. It's a chronic illness, so it's quite similar to conditions like diabetes, blood pressure. They don't remit spontaneously, but it doesn't really usually affect it doesn't really cause mortality like the way diabetes and blood pressure does, but it can cause a lot of psychological damage as well as inconvenience to the patient.
With this long history of having to take injections all the time, are there side effects to these injections?
Biologic therapy do have their own profile of adverse effects. So most commonly, we do see local site injections. So quite similar to the COVID vaccine, you can have, aching, pain, bruising on the injection sites. Sometimes patients can get a mild flu-like illness or symptoms, can get a bit of a headache. some of the biologic therapies are somewhat still a bit immunosuppressive, so they may also get high risk of infections.
So, like you mentioned early on, right, doctor? Sometimes, triggers for skin conditions, be it eczema or psoriasis and all that, could be due to psychological issues. Like when you're stressed out or whatever, it flares up. So, someone who has a very bad case of psoriasis, for example, like what you mentioned, and who's being affected mentally by the condition, it's quite possible that could be one of the reasons why the psoriasis never gets better.
Continuing.
Because the person is sad.
It's
of course.
continuously
And
under
worried.
stress.
Yeah, because of the skin condition. So it's like
Chicken
you're
and
right.
egg issue.
Chicken and egg issue.
Exactly. And for someone who doesn't really have that bad psoriasis, I'm just thinking about myself, right? Let's say if I had psoriasis, but it's a very minor psoriasis, but I don't want the cream, I rather the injection. Will you be able to give me the injection?
If you have mild psoriasis,
Yeah.
and if you are keen for injection, that's also still possible.
Okay.
That's
There you
also
go.
still
Okay.
possible.
It's
It
so
will
much more convenient, right?
Definitely.
Because it's like once a month and then you don't have to put the creams on or remember
there are
it.
many biologics currently in the market. I think in the Singapore market, there's around 7 to 8 types, and all of them have different profiles in the sense they help with different subtypes of psoriasis differently, and they have different frequency of injection as well. So
Right.
have to sort of get to your doctor to sort of personalize your care and give
Okay.
something that is customized.
I want to ask you about babies and testing for psoriasis.
Okay, that's next. It's 8:15.
Kiss 92 Time Check brought to you by
So, doctor, you mentioned earlier that it's mostly hereditary, right? Not all the time. I mean, say like majority of the time it's hereditary. Can you test for it? Say when a mother is pregnant or when a baby is born, whether the baby is going to get psoriasis? Is there a gene that is in the child?
There are genes that are postulated to be linked to psoriasis,
Okay.
but unfortunately, I am not aware of any genetic testing available for psoriasis at the moment. A lot of times, it's still a clinical diagnosis as well as examination.
So
sort
it's
of.
only once it flares up that you know.
Once it manifests,
When-
but if a person has a parent who has psoriasis, then be mindful that it may manifest in the same way.
Okay.
But then again, other skin conditions like eczema is a lot more common, so sometimes it's difficult to tell apart. So even if your parent or your sibling has got psoriasis, doesn't mean that you necessarily have a skin condition that is equal to psoriasis. So yeah, it can be variable.
Okay.
So, doctor, could other skin conditions lead to psoriasis?
I was going to ask that, yeah.
Skin conditions that lead to psoriasis.
Like if someone who perhaps maybe has been diagnosed with eczema and thinks that
They can
okay,
coexist. So patients with eczema can also have psoriasis, especially in the Asian population. So we are not quite similar to the Caucasian populations, whereby eczema and psoriasis patients are very distinct subtypes. In Asian patients, we sort of blend in sometimes.
Right.
There are also certain immune conditions, such as immune blistering conditions, such as bullous pemphigoid, which is also linked with patients with psoriasis. They can coexist.
Wow. That must be painful, though.
I know.
I mean, to
Yeah.
have both at the same time.
That's crazy.
One thing, let's talk about me, right? I can't wear a chain, for example, because I play a lot of sports and stuff like that. And I realize that when I perspire, for example, and that perspiration comes into contact with whatever I'm wearing, okay, it leaves a little bit of an itch. Is there a name for that condition?
So it could obviously we have to still see the physical appearance of the rash, but
Right.
from what it sounds like, it could be a form of eczema, because eczema tends to flare with sweaty environments, dusty environments, humid environments. But we also need to consider things like contact dermatitis. So there are patients who have allergy to things like nickel.
Yes, yes.
Nickel allergy, which
Yeah.
is commonly found in jewelry,
Yes,
chains.
I definitely have that.
There is also a form of pressure-related urticaria. So when you scratch your skin or induce friction, you develop hives, which can also be somewhat similar to something that you may have described. So having a rash can be something that is very variable. So do if you do have a condition and you do intend to see a doctor, to take some photos so that when you do see a doctor, you can show the doctor or your dermatologist the photos of the rash. Yeah.
Okay.
I'm kind of interested because you brought up urticaria. A question we've asked doctors, not dermatologists,
Sure.
doctors. My wife has developed urticaria, so I know what you mean by pressure,
Hives.
the pressure of a scratch. But it happened after COVID injections.
So, COVID vaccine induces the body's immune system to be able to fight off COVID infections,
Right.
and that may have influenced or modified the immune system in some ways that may cause skin conditions like this to occur. So, not just particularly for urticaria conditions, there are conditions that may have increased in prevalence after COVID vaccine. It's something that we do see on and off. Yeah.
Okay.
Okay.
And there's no cure for that, right? I mean, it's just
For urticaria, there is also medications
Yeah.
and also biologic therapies, which we were discussing just now.
Yeah,
For patients with unforgiving chronic urticaria.
interesting.
They're like, just go for the injection.
I'm gonna tell her to go see the
Injections are the best.
I'm going to go and tell her to see the doctor. That's
Well, she doesn't have her own doctor.
We go to a family clinic now, and it's what do you call it? She's on Telfast.
Antihistamines.
Yeah, which works, but I don't think it should be the end solution. There must be more to it than that.
That's why you gotta see a specialist.
Yes, and now we have the specialist.
Does psoriasis show up mostly in children, teens, adults, or it's across the board?
Psoriasis usually develops from age 20 and above.
20 and above,
20
okay.
and above.
That's
But we
young.
do see pediatric psoriasis on and off, although it's much less common.
Okay, and then if you see pediatric psoriasis, this means they're going to live with psoriasis for the rest of their life.
It may flare with environmental triggers, so there are good days and bad days. But psoriasis doesn't remit, so it is there usually for a long, long time.
Does it affect the kind of like soaps and, shampoos and stuff like that you use?
Not directly related, not quite like eczema, but the use of harsh soaps, bar soaps, tend to dry out the skin, and you may manifest more itch from the dry skin, which is already detrimental, especially when you have existing psoriasis.
And scents as well, I'm sure, right?
We try to
Perfume.
avoid those. So if you have a skin condition, try to look for soap substitutes. So essentially, gentle cleansers that behave like soap, but they are not soap.
They cleanse like soap.
Yeah.
But it's not a hygiene issue, right? I mean,
Definitely not.
psoriasis.
Psoriasis is not a hygiene issue. So when you see someone with this psoriasis rashes, it's not because they haven't showered. It's really not their fault. It's not a hygiene issue. It's not contagious.
That's very judgy.
Maybe it's
though,
because
'cause
they've
a
been
lot of people-
showering 10 times a day. That's why they're feeling itchy. Skin's all dried out already.
Dried out, yeah.
I had a question just now. All of a sudden I've forgotten now. Okay, go ahead.
The other thing I wanted to ask, we're talking about soaps and we're talking about scents. Whenever a soap has a scent, it has an alcohol base somewhere,
May or may not be true.
right?
The essential oils, some of them have essential oils as well.
This is whose theory? Your theory or
No,
what?
because Michelle has this problem. She's got everything she uses cannot have alcohol because is that the same with psoriasis? Would alcohol be a trigger?
A consumption of alcohol can trigger psoriasis. The use of alcohol on the skin may or may not be.
May or may not. Okay.
So we have a question on that's come through our WhatsApp doctor from CW. I'm 40 years old and recently developed, let's hope I'm getting this word right, dermatographia. There's been no lifestyle change. May I know if there's any reason that could have triggered this allergic reaction?
Dermatographism is a condition that is under the big umbrella of urticaria. So patients with dermatographism scratch the skin and they leave the urticated rashes or hive-like rashes in the form of the pressure. So it may have been an allergic reaction, but it's usually not. So go see a dermatologist, and if needed, we can do some allergy testing in the form of a skin prick test or blood allergy testing thing. But dermatographism, patients with dermatographism usually has a negative allergy test. We treat it the same way as chronic urticaria, whereby we tell the patients to try and avoid direct friction and pressure, and with antihistamines or currently with biologics as well.
Okay, all right. We're going back for traffic, and then we've got another question from WhatsApp.
Yep.
Kiss 92 traffic.
On the PIE towards Tuas, right before Jalan Baha, please avoid lane 1. An accident has been reported. Also, if you're in the CTE tunnel heading towards the AYE, a vehicle's having a bit of trouble after the Bukit Timah Road exit and taking up space in lane 4. Wherever you are this midweek, stay safe.
Good morning and welcome back to The Big Show and The Big Show TV. Today we're talking about everything that is, skin related, because we have a consultant dermatologist from Parkway MediCentre with us, Dr. Joseph Toh, who will be with us next week as well. And my producer, Shalini Susan, just sent me, passed me a note. And based on what I see, next week is going to be my week with
why?
the doctor,
Really?
because we're going to talk about sun exposure next week.
There you go.
Oh,
Absolutely.
yeah. This is
And
definitely for him.
I spend hours and hours and
Oh
hours
my
under the
gosh,
sun playing
yeah.
golf. And as a
It's-
result of that, I get like heat rash and stuff like that. So next week,
Yeah.
I'll find out if there's a solution to that. And
Awesome.
don't tell me not to play golf.
Cannot. This one.
But you know what? As much as it's for you, it's for me as well, because I am a fiend when it comes to sunblock. I'm like non-stop. I have so
Everybody
many
can
different
tell.
types.
That's why you're so fair.
Thank you. So many different types. Anyway,
She
but-
walks around with the umbrella.
Yeah, I have. Yeah, I
She
have
has
to.
to.
I have to.
Same,
Yeah.
same.
But that,
Giant umbrella.
He feels umbrella,
Giant
sometimes
umbrella.
a hat, sunblock, everything. Anyway, that's for next week. But we're talking about psoriasis, but we have a question about eczema from Huma, who sent in a WhatsApp message. She says, I think I have eczema around my hairline, behind my ears, down near the neck. Every time after exercise and sweating a lot, oh my God, that area gets terribly itchy. What triggers / flares up the itchiness there, and what can I do to minimize the impact? Do you have any advice?
So patients with rashes around the hairline, around the behind the ears and the nape of the neck, it can be a form of eczema, but there's a special type of eczema called seborrheic eczema, where patients get rashes, particularly in the scalp, as well as behind the ears and even on the face, and this is usually manifesting as greasy red patches due to the overgrowth of yeast on the skin. So do consider cleansing the skin with a gentle cleanser, avoid harsh soaps, use a moisturizer frequently, and if needed, go see your dermatologist or doctor for a topical prescription, which can help with these rashes. Avoiding heat, humid environment, sweaty environment can help. Another particular thing that we need to consider would be the use of hair dye, because there can be allergic contact dermatitis to hair dyes as well, which is common. You may have no problems with this particular hair dye in the past, but you must understand that your skin constantly change. So something that you may not have a negative reaction to in the past may not equate to no reaction in the future or current. So if there's a pattern with the use of hair products, especially hairstyling items as well as hair dye particularly, do consider the fact that it might be a contact dermatitis.
Okay, all right.
another question coming through on our Facebook page. This is regarding psoriasis management. Are there health supplements or foods that we should be consuming to help manage psoriasis?
Unfortunately, no. So no particular food or health supplement, oral supplements can make some psoriasis remit. Unfortunately.
Okay, no magic pill just
No
yet.
magic.
All right. It's been great having you on the show, Doctor. We look forward to being with you again next week on Good Morning, Doctor.
I'll make sure he puts his sunblock on before
Yeah.
he comes in, okay?
Hey, I put sunblock on my face. Problem is I don't put sunblock on my
Yeah, so
on
you
my
gotta
body.
do it
you see.
everywhere.
That's
yeah.
why. Anyway, so keep those questions coming in regarding, your skin condition or whatever, because as I mentioned, Dr. Joseph Toh will be with us next week on Good Morning, Doctor, once again. Thank you so much, Doctor, for joining us today.
Thank you for having me. Thank you.
Thanks for tuning in to The Big Show's Good Morning Doctor.